So today we make custom trays. Go ahead and with the Sharpie mark tooth number 19 and tooth number 3 on the side, on the underside of your cast. Those would be the preps that we're going to make the final impressions on. The next step is to take a piece of tin foil and go ahead and adapt that well to your cast. You want to adapt it so that you can see the tooth anatomy, because what you want to do is measure 5 millimeters apical from the free gingival margin with your probe. That's how far the wax spacer will need to extend down onto. You can mark the 5 millimeter junction with a Sharpie to make it easier for you to see. So the next step is to take a sheet of boxing wax. Now boxing wax is 2.5 millimeters thick and it serves as our spacer. What you want to do is start in the buccal and just start to wrap the wax around the teeth. And you can take a Bard Parker and put some slits in at the canine region, and we'll fold those over. Just a quick demo on how to load your 25 blade. You'll take it out of the package and you want to line up the bevel of the blade to the bevel of your handle. Once you got those lined up, you can see that there's a slot in the blade, and you'll match that slot to the handle and it should slide right in. To remove the blade, you want to take a hemostat and gently push up on the blade. There's a little tab to push up on, and you'll grasp the blade and gently slide it out, and the discarded blade can go into a sharps container in the back of the sim clinic. Go ahead and fold over the posterior regions first. The goal is to have a complete surface contact without thinning out the wax. We aren't going to cover the palate. What you can do is you can cut a little triangle in the anterior to make the wax there evenly spaced, so you don't have a double sheet of wax there. Go ahead and fold the anterior part over, and you can trim the remaining excess wax. In the posterior, you can put a triangular piece of wax on the distal of the posterior molar. This will provide appropriate relief for the tray around the most posterior tooth. Add a second sheet of tin foil over the wax. Make sure the anterior border of the foil extends far enough facially to cover the wax on the facial of the central incisors. Using light finger pressure, adapt the palate first, followed by adaptation of the foil along the entire arch. We'll be fabricating ramped tray stops, so the stops should be placed on non-functional cusps and should not interfere with the prepared tooth or teeth. For the maxillary tray, we're going to put those onto the posterior buccal cusp, as well as on the anterior of on tooth number 8. Place your cut through the top layer of foil and wax with a 25 blade. The lowest layer of foil should be maintained. You want to make that about 3 millimeters wide. Put 2 more horizontal cuts at the top and bottom to complete your tray stop ramp. With a discoid cleode, you can flick out the top layer of the foil as well as the wax. You want to try to maintain that lower piece of wax if possible. Go ahead and repeat the process for the other 2 ramp stops. You want to then place some tin foil into those ram stop areas. This is to prevent any wax from touching the Triad material, so the wax doesn't stick onto your tray. Go ahead and take a little piece of the Triad and stuff it down into your ram stop area. This is to ensure that acrylic gets into the space that you had created. After that, you want to take your Triad and start adapting it to the teeth. You want to ensure to cover over the areas that you had extended with wax, and the material does tend to be kind of like Play-Doh, where if you push together, it'll start to mesh together. So one of the tips we have is to use a little Vaseline and under pressure kind of smooth out the junction to get a seamless transition. Be sure to also trim overlapping areas. The idea is that you want a consistent thickness of Triad throughout your tray. So if you have too much in one area, then you want to trim that off. And as you apply pressure, don't push so hard to as to thin out the tray in any certain area. Thin areas of the tray may lead to the tray breaking and also maybe potentially distorting your impression. Once you have the Triad material well adapted to the cast, what you want to do is trim the Triad, and you want to ensure that the Triad extends at least that 5 millimeters past the free gingival margin. The smoother you can trim this area, the easier it is to finish and polish after it's cured. So pay careful attention, make nice clean cuts with your sharp 25 blade. Next step is to fabricate your tray handle. So you want to make the tray handle about 20 by 10 millimeters in a rectangular shape, and the handle should be at least 5 to 7 millimeters thick. You need this thickness for rigidity of the tray, or rigidity of the handle. You don't want it to break off on you. Again, ensure that the junction between the new material you're adding on and the original tray is seamless, so you can use some Vaseline to help smooth that out. Once you have the tray in the proper position, you can take a light cure and cure it for about 20 seconds, 1 to 2 times, until rigidity is achieved. We want to do this prior because when you put it into the curing light oven, there's a chance that the tray handle may slump on you. This is a Triad curing unit, so the on and off switch is in the back. The two switches in the front, one is to turn on the light, the other is to ensure that the table is rotating. The middle knob is for the setting amount of time, and there's a knob at the top of the unit that can alter the height of the platform. So you want to ensure that the height is adjusted so that the light is shining onto your tray. The next step is to remove the tray from your cast. At this point, you want to do that right away while the wax is still a little bit warm. This will facilitate you removing the foil and the wax in one piece. It's much easier to do this when the wax is a little bit soft. It should peel right out. Go ahead and put on your acrylic burr, and what you want to do is just trim off any sharp edges. You don't want anything that may be uncomfortable to your patient as you are seating the tray. After you've trimmed it up, you can go ahead and put it back into the oven for another 4 minutes for a final cure. This ensures complete polymerization of the material. The next step is to repeat the process for your mandibular tray. It's very similar in procedure. The only thing to pay attention to is where your functional cusps are. So our functional cusps on the mandibular are on the buccal, which means you want to put your tray stops onto the lingual cusp. And on the anterior, you'll put that in the area of 24 or 25. Obviously, you're not going to have the tray extend onto the tongue area, so that part of the tray will be open. Go ahead and watch the rest of the video.